I'm really more going to talk about the challenges rather than the what to do. And I've used, are you from Family Planning Victoria? Sorry, because I just arrived. Your material's excellent. I've got that and great. I've used that, yeah. So just starting with, have a think about how do we know another person understands about what we have said? What do you think are the things that would tell you, yes, Nina knows what I mean when I've said that and understands? Now, you're not allowed to say because we're pretty good at this.
If they can say it back to you in a different way.
Yeah, and how would you know, and this is, you know, it's a difficult question, but how would you know that they've actually know what to do with that information? When to use it?
They can demonstrate through scenarios what they would do.
Yeah, yeah.
They give you examples.
Yeah, yeah, no, good. I'll tell you a story. So, a policeman saw a scruffy-looking older man. You probably heard this. If you have, just laugh anyway. Saw a scruffy-looking older man walking along Flinders Street with a penguin beside him. And he went up to the man and he said, "What are you doing with a penguin in the city?" And the man said, "You should take that penguin to the zoo." And the scruffy old man said, yes, officer, I will." A few more days goes by and the policeman's in directing traffic again in Flinders Street and he sees the man with the penguin and he goes a bit cross this time and he goes up to him and he says, "I told you to take that penguin to the zoo." He said, "I did, your officer, I did. And today I'm taking him to the pictures." So what did the policeman not tell him to do?
Leave the penguin.
Leave the penguin at the zoo. Exactly. So I think this is a good way to understand when you're working with people with intellectual disability how precise and clear we have to be with what the message that we're trying to get through. So I'm just going to use a case study and you know, that's occurred in our workplace in recent years, and it's by no reflection on the counsellor involved, believe me, because it's just such a hard space. So a 12-year-old girl, she'd been sexually assaulted, she was with a disability. The background to that is to very widespread, long-term, generational sexual violence, poverty, family violence, so very poorly resourced young woman as well, child protection order in place for the children, all of that, as well as having an intellectual disability. She was brought in for counselling. The counsellor did 12 sessions with her. It might have been 14, I can't remember exactly. And, you know, it was all about letting people touch you and who should touch you and, you know, all that sort of stuff. Not that I knew that at the time. I just, this is after the event, I found that out. And she used various methods to do that. My involvement was with the child's mother. I've never met this child or the sister, and the mother was with me one day and said that this 12-year-old was, since she'd last been to the Royal Children's Hospital, changed her medication. She was having nausea, and Mum said, "Oh yeah, I reckon I'll just take her back down to the Royal Children's," and you know that just didn't seem very good option. So I offered to get the young girl an appointment with a GP at Community Health who specialises in adolescent women's health, because I thought, if nothing else, she would be able to at least liaise with the Royal Children's rather than get the child down there. So that's my involvement. So I never met this young girl. So she goes over to the GP and has her appointment there, and the bomb tells the GP she's having consensual sex with her 17-year-old boyfriend. The counsellor, she even cried when I told her. And then, because child protection was involved and, you know, I had to notify them as well, of course, they all said, "Oh, no, maybe it's her older sister." And I hadn't met them. I thought, yes, that could be the case. I could have actually made that, you know, got the names mixed up or something. But no, went back and checked and it was definitely the 12-year-old girl who was having supposedly consensual sex with a 17-year-old known male. So what do you think happened in what messages didn't get through in the counselling questions, do you think? I'm making you people do all the work, because really this is not my area of expertise. I was going to say at the tables, there's not enough of you.
Well, it's not giving people information. Actually, this is in that article that I've just given you the reference to. Doesn't actually mean that they will act on that information or are able to act. It's not so this article I've just given you talks about critical health literacy, if we put it in health promotion terms, and that's actually the empowerment bit. So just because you've got information doesn't actually make for behavioural change necessarily, whether it's around sex or smoking or whatever it is.
Yeah.
It's actually, information isn't power, ultimately, and so the counsellor did all who can touch you there, but that comes with a whole lot of provisos and assumptions around the context you're going to be placed in and all those sorts of things.
Yeah.
So, I mean, information isn't power.
No,
And so
that's right.
information, this notion of critical health literacy that is defined a long time ago but has been forgotten about is actually what's important, and that's the added thing. So it's giving them information, having them repeat it back, but still that doesn't guarantee it. It's actually them actually demonstrating that they've acted on it.
Yeah.
And that can be a long time coming.
Yeah. 12 sessions, probably not enough. And as you were saying as I came in, the growth and development of that young person will change.
And the context.
That's right. And also, I wonder if the counsellor spent all the time talking about unwanted sex. Did she actually talk about what to do when you want to have sex and what sex constitutes, that it's this range from a kiss to perhaps some kind of penetration, and there's all these different things you can do in between, and that you can consent to them along the way, even if you really, really like the person and you like what's happening to you, and that there are certain consequences to having unprotected penetrative sex with someone of the opposite sex, and that is there's pregnancy. So because it's more, if a person would be inclined as a counsellor when talking to a 12-year-old to not talk about wanting to have sex, to just be talking about what to do when you don't want to have sex. They would never think to talk about the fact that you might have a boyfriend or a girlfriend, and that you might want to engage with them sexually, and that you need to use contraception. I mean, it's only the tip of the iceberg, the story.
Yes,
That
that's
they
right.
would probably.
Could it even be the language, like we're talking about sexual assault, maybe the counsellor is referring to it as being assault, and with the boyfriend it's talking about sex, so she thought they were two completely different
Loving.
things.
One's sexual assault, one's love.
Yeah.
Yeah.
And also, you don't know what the assault was, what people have done to this 12-year-old in the past. It might have never have been penetrative intercourse, so they don't even really know about that. It might just, I don't know, it can be a whole bunch of other things.
Or that link that if it's wrong, it will feel bad.
Yes, yes,
Yep.
yes.
And just feeling like they would know if it was wrong because of how they felt in the situation, rather than understanding the context around that and the legal framework and stuff.
I'm going to put you on the spot, Kim. Do you have anything? But it's all great discussion, and it just shows. I guess what I want to point out is how difficult it is in working with these people. And 12 sessions is a lot of sessions for that topic. That with an intellectually competent person, that might be 2 sessions. Did you want to add anything? Don't feel pressurised. Just no pressure. Just do it.
I think there's a lot of variables with counselling, and obviously even the confidence of people, values, judgments come in, so absolutely how we approach the conversations matter, the inflections of our voice, how aligned we are in the family system, it's complicated stuff. If you're in a way treading close to opening up a potential disclosure, and I think in children's work it's delicate and it's got to be really well considered.
Yeah. And even one simple thing could be, I know when I worked with the young women that I did, we talked about, I suppose, bad touching. I'm not sure if that's the exact term that I used, we talk about good touching as well, because I was actually educating people about sexual and reproductive health. But I guess maybe in this scenario, the term that you can actually enjoy it, or if it feels good, it's okay, sort of thing, didn't come up. We don't know. I mean, the poor counsellor, she's gone now. She was so upset about it all. I don't think that prompted her resignation, but didn't want to delve too far. And we had a child protection issue to deal with. We had lots of other aftermath because of that to deal with, so we didn't go into any detail. But the other thing I think with we all see things differently. So just wondering what you see here. Who you've probably seen it before again. What do you see, Matt?
I see a face, we work here.
You see a face?
Or I see an Eskimo.
Oh, you're just too smart.
Sorry.
Does everybody see both?
Yeah.
The
Yeah.
face and the Eskimo? Mate, I must have picked one that was just too easy for you. But it's just, trying to demonstrate that even we can see things completely differently. Many years ago I worked as a nurse educator, and my colleague and I developed a advanced life support package. And if you're not a clinician in health, you wouldn't understand that advanced life support is an algorithm. You do this, and this, and you have to do that to give the best chance of getting the person, their heart going again and back to life. And so we put together this package that people had to answer the questions for first, and then if they passed that, then they go on and do the practical. Well, there were a number of, at least 2 or 3 questions people gave different answers to, and they were both right. It was very frightening to think, oh no, in the ALS you can't have that. So it made us very clear about how we had to go back and make it so precise. And when you're working with people with IDs, they take everything literally, and it has to be, and you're the expert here, not me, so you just chime in anytime you
Can I just give an anecdote that adds to that?
Yes.
There was a colleague of mine who was giving sex education in a residential facility, and there were 2 people who they thought were engaging in sexual activity with each other, and they showed them how to use condoms by putting them on the end of a broomstick. And so then they were found having sex at some point with a condom on a broomstick next to them. So concrete thinking, like they thought they were doing exactly what they'd been taught, and they were in some ways, but that concrete thinking, you have to really think about how you do things so that you're checking that.
So how would you actually do condom
Well, I would
demonstration?
use something a little bit less abstract than
A penis model.
Yeah, exactly.
As close to reality
Yeah,
as
exactly.
possible.
Yeah.
And then
Yes.
you show pictures
of
a
a person.
with it on there.
Yeah.
Yep.
Yes.
So you just have to show
No euphemism.
honest, real, everything.
Yeah.
Yeah.
And I think that's where, like especially in counselling, you do end up with people and their values. Because I know a counsellor can't even say parts of the body, and if you get anywhere near actually naming genitals, watch her face go red and she's got to end the conversation. You go, that's really interesting working in this sector.
Well, how do they work at CASA? Sorry, like I would
actually
actually wonder how they work at CASA then.
Yeah.
Like, to be
It
honest.
shouldn't be, but you do come across people, and I guess values bring you to the work, but also values can get in the way of it in terms of, how you're going to approach the conversations or approach the education. That you do come up with a lot of areas in people's lives that have stigma, so it's interesting.
Yeah, so explicit language, the actual terms, penis, vagina, etc., and all the rest of it. I just got this information from the Australian Disability Clearinghouse in Education and Training, and it just states the characteristics and impact of a person's intellectual disability will vary upon each case. So these are just a number of the common characteristics, and you can read for yourself. They have difficult understanding new information. Often communicating is difficult for these people, especially if you're working with someone who's almost non-verbal. Slow cognitive processing time, so something you take 2 minutes to tell an abled person intellect, might take 10 for them to process that information. And the sequential processing, I had a good example of that. forgot to write it down. And difficult comprehending abstract concepts. So very concrete thinkers, as I think you said before. So now we've got a little activity. So, and again, I was going to get you to do this at tables, but we can just yell it out if everyone's happy to do that. Got a 12-year-old girl with an intellectual disability. You're working in a community health centre where you're limited to time, of course, and you've got 1 hour to tell her about the menstrual cycle. Do you think that's possible to do that in 1 hour?